Transgender men are assigned female sex at birth but identify as men. Gender-affirming hormone therapy for transgender men includes exogenous testosterone administration. The current recommendation is to undergo fertility preservation before any exposure to testosterone or to stop testosterone therapy at least 3 months before the preservation. Our study aimed to assess the impact of testosterone exposure on fertilization and preimplantation embryo development from in vivo matured oocytes collected from transgender men. We performed a retrospective analysis in vitro fertilization cycles conducted at our clinic to compare morphokinetic parameters between a group of testosterone-treated transgender men and 2 groups of cisgender women. Embryostatic morphology was also assessed and compared between these groups. 7 transgender men cryopreserved embryos in our unit during the study period and were included in this study. The control group were composed of 34 cisgender women, of whom 10 were fertile and had cryopreserved embryos, and 24 had undergone fertility treatment. The transgender men were significantly younger than the cisgender women in the study. After adjusting for participant age, the fertilization rate was comparable between the transgender men and both cisgender women groups. There were no significant differences between the transgender men and the cisgender women in the number of cryopreserved embryos or the distribution of the embryos' ages at which they were frozen. All morphokinetic parameters that were evaluated by time-lapse imaging and morphologic characteristics were comparable for the embryos of all 3 groups. Our conclusion was that testosterone exposure among transgender men has no adverse impact upon fertilization rates or preimplantation embryo development and quality.